Hello, I'm Judd Semmingson, the CEO of Community Clinic. Community Clinic is an outpatient primary care system located in Northwest Arkansas. We currently have 19 locations across Benton and Washington counties, serving almost 44,000 patients annually. The focus of our system is that outpatient family practice delivery and can span from early childhood and pediatrics through older age and adulthood. We serve a number of patients throughout their chronic care journeys or acute needs. And today we see that a variety of challenges face our healthcare system and the patients that we serve. This can be both challenges in efficiency and mandated reporting components. And we see that burnout is rampant amongst our healthcare providers. On the flip side, we see from customers and patients the need for access and the need for information to lead better, healthier, vibrant lives and remain productive in all of our communities that we serve. Community Clinic shares this footprint with other healthcare providers in Northwest Arkansas, but more importantly, works with additional community health centers across the state of Arkansas. Our goal being that best practices don't live in a bubble and that we work collectively to ensure the health and well-being across the state. As we look forward, many of these opportunities to overcome these challenges will lie in technology. And as such, we have partnered with Health Tech Arkansas to develop an accelerator program, with the goal being to develop new and innovative technologies to work to overcome these challenges and create economic vitality throughout the state of Arkansas. As we look at how we will do this, we're going to walk through this today. The objectives of the accelerator are twofold. First is that we're going to pilot digital health innovations. These are by leveraging and finding existing accomplished early stage venture-backed companies that already have advanced digital health innovations. This way we can work with those companies to increase access to care for the broad communities that we serve, including underserved communities and rural communities. We would work with other partners to take this opportunity outside of Northwest Arkansas and make sure that it blankets the state of Arkansas. These would provide guaranteed pilot-ready projects and clinical trials in combination with Community Clinic, our partners, and Health Tech Arkansas. The second component of the accelerator is to develop new innovations that ultimately would lead to commercialization. This would be done by performing challenge and design sprints both within Community Clinic and our partners, and the goal to develop new innovations that achieve economic development across Arkansas. As we look at the first objective, this would be three components. First is we recruit those companies that are those accomplished and early stage pilot-ready companies that already have an existing digital health solution. This would help us to increase access and care for our existing communities. In combination, the teams at both Community Clinic and Health Tech Arkansas would vet and screen those applicants, and ultimately would expand the opportunity to participate in both urban environments and rural environments across Arkansas. When we look at the structure, the companies that are selected by these sites to participate, Health Tech Arkansas would help to structure and facilitate those pilot projects at those Arkansas sites. The value proposition is twofold as well. For Community Clinic and other Arkansas providers, the opportunity to pilot those existing health solutions can increase access to care. It increases our opportunity to continue and expand our practice, ultimately to see more patients and grow our revenues, strengthening our business component. We share that opportunity with others across the state. Likewise, we guarantee some pilot-ready projects inside of Arkansas with healthcare providers, which generates data and the ability for these companies to continue to gain in market traction. As we look at track 2, the development of internal innovations, this has 4 components to it. And first is identifying the challenges. We already know some of the companies that exist in track 1 have models in mind and already solutions built in. But what about those challenges that we see that don't have those solutions ready-made? This is where track 2 comes into place. We identify those challenges through a component of challenge sprints and design opportunities with our internal teams at our healthcare facilities. We then research those opportunities to see what components could be out there for new innovations to be developed. We combine and match cross-disciplinary students coming from the realms of health or business or public health and look to develop new innovations. And finally, we conduct these engineering and prototyping components, perform regulatory assessments, and ensure that we have safety and efficacy built into any of these clinical studies in partnership with Community Clinic and Health Tech Arkansas. The value proposition for this track is broad. First, it's the state of Arkansas in that we are creating medical innovations that strengthen the economic viability of our healthcare providers. We will also work to improve the overall health and well-being of our workforce. And finally, we create intellectual properties that can form the basis for new health tech startups. When we look at these providers and creating that intellectual property, the goal is to move it to commercialization. That then provides further economic benefits and enhances the culture of innovation within our own organizations and beyond. And finally, for those student and clinician inventors that work to solve these clinical challenges, they are able to then be listed as inventors on patent applications and provides them additional opportunities going forward. As we look at how we would utilize the potential grant proceeds, the majority of this would be funded towards staffing. This is both staff within Community Clinic and Health Tech Arkansas when we look at program management, as well as interns from the various universities. The final component of the funds would be used for fixed cost, including things such as engineering and prototyping, patent applications, and regulatory assessments. As we look at the potential economic impact of this accelerator program, it's twofold. First is strengthening and ultimately growing our state's provider organizations. We do so by administering a platform that allows both Community Clinic and other providers to evaluate and adopt these new innovations, increases access to care, and pays forward that economic benefit by maintaining health, vibrant, and productive communities. We ultimately are able to internally grow our own revenue and expand services and maintain and strengthen our existing businesses. The second fold of economic impact is that intellectual property development. We've created new innovations that are built around real-world challenges faced by our healthcare providers and teams. And ultimately, we drive these new innovations to commercialization, licensing revenues, and the startup companies that follow, with the ultimate goal to increase the viability of new innovations, new companies, and increase the economic impact throughout the state of Arkansas. It's been a privilege to present this to you today, and we look forward to continued conversations moving forward.